Cardiogenic shock. Cardiogenic shock is a dangerous condition wherein your heart out of nowhere can't siphon sufficient blood to address your body's issues. The condition is frequently brought about by an extreme coronary episode. However, not every person who has a respiratory failure has cardiogenic shock. Cardiogenic shock is uncommon. It's frequently lethal if not treated right away. When treated quickly, about a large portion of individuals who foster the condition endure. Side effects. Cardiogenic shock signs and side effects include quick relaxing, extreme windedness, unexpected, fast heartbeat, tachycardia, loss of awareness, feeble heartbeat, low pulse, hypotension, perspiring, fair skin, cold hands or feet, peeing not exactly typical or not in the slightest degree. Side effects of a coronary episode. Since cardiogenic shock as a rule happens in individuals who are having an extreme cardiovascular failure, it's essential to know the signs and indications of a coronary episode. These include pressing factor, completion or a crushing torment in the focal point of your chest that goes on for in excess of a couple of moments, agony spreading to your shoulder, either of your arms, your back, or even your teeth and jaw, expanding scenes of chest torment, windedness, perspiring, dazedness or abrupt tipsiness, sickness and spewing. Look for clinical consideration immediately while having these signs or side effects to diminish your danger of creating cardiogenic shock. When to see a specialist. Getting respiratory failure treatment rapidly improves your opportunity of endurance and decreases harm to your heart. In case you're having indications of a respiratory failure, call 911 or other crisis clinical benefits for help. In the event that you don't approach crisis clinical benefits, have somebody drive you to the closest emergency clinic. Try not to drive yourself. Causes. As a rule, an absence of oxygen to your heart, ordinarily from a cardiovascular failure, harms its fundamental siphoning chamber, left ventricle. Without oxygen-rich blood streaming to that space of your heart, the heart muscle can debilitate and go into cardiogenic shock. Once in a while, harm to your heart's correct ventricle, which sends blood to your lungs to get oxygen, prompts cardiogenic shock. Other potential reasons for cardiogenic shock include irritation of the heart muscle, myocarditis, disease of the heart valves, endocarditis, debilitated heart from any reason, medication excesses or harming with substances that can influence your heart's siphoning capacity. Risk factors. In the event that you have a coronary episode, your danger of creating cardiogenic shock increments on the off chance that you are more established, have a past filled with cardiovascular breakdown or coronary episode, have blockages, coronary core sickness, in a few of your heart's fundamental conduits, have diabetes or hypertension, are female. Entanglements. If not treated promptly, cardiogenic shock can prompt demise. Another genuine confusion is harm to your liver, kidneys or different organs from absence of oxygen, which can be perpetual. Counteraction. The most ideal approach to forestall cardiogenic shock is to make way-of-life changes to keep your heart solid and your pulse under wraps. Try not to smoke, and keep away from used smoke. On the off chance that you smoke, the most ideal approach to decrease your respiratory failure hazard is to stop. Keep a solid weight. Being overweight adds to other danger factors for coronary episode and cardiogenic shock, for example, hypertension, cardiovascular infection and diabetes. Shedding only 10 pounds, 4.5 kilograms, can bring down pulse and improve cholesterol levels. Eat less cholesterol and immersed fat. Restricting these, particularly soaked fat, can diminish your danger of coronary illness. Stay away from trans fats. Utilize less salt. An excessive amount of salt, sodium, prompts liquid development in the body, which can strain the heart. Focus on under 2,300 milligrams, mg, a day of sodium. Salt can be found in many canned and prepared merchandise, so it's a smart thought to check food marks. Scale back sugar. This will assist you with keeping away from supplement helpless calories and assist you with keeping a sound weight. Cut off liquor. On the off chance that you decide to drink liquor, do as such with some restraint. For sound grown-ups, that implies dependent upon 1 beverage daily for ladies and up to 2 beverages per day for men. Exercise consistently. Exercise can bring down your circulatory strain and improve the general strength of your veins and heart. Get at any rate 150 minutes of moderate oxygen-consuming movement or 75 minutes of enthusiastic high-impact action 7 days, or a mix of moderate and overwhelming action. It's prescribed to fan out this activity over the span of 7 days. More prominent measures of activity will give significantly more noteworthy medical advantages. On the off chance that you have a respiratory failure, fast activity can help forestall cardiogenic shock. Look for crisis clinical assistance in the event that you believe you're having a coronary episode.